Hello, good morning again. I'm Dr. Sanjay Khanna. I'm a gastroenterologist at BA Kapoor Hospital, if you remember, and I've been Jimmy's doctor for the moment. Just to tell you that Jimmy has been doing very well with the medication provided. The pain in the throat, the heartburn, and the other symptoms have gone. He needs to continue the treatment for some more time, and then we need to follow him up once, maybe after 6 to 8 weeks. But for the moment, he's perfectly fine, fit enough to sing, travel back home, and do his normal routine activities. And maybe over a period of time, we can just follow him up. Thank you.
Hey, what's up? Thank you so much for tuning in again. You've heard what the doctor has said. I am free to travel back home. I can't be more excited than this moment. This Saturday, I'm coming back on 14th, 5 p.m. I land at JKIA. Oh my God, I feel so good. When I came here, I was feeling pain on my throat. I was spitting blood sometimes. When I sing, I would feel so much pain. But today, the medication has worked, and the rest of the medication that I'll take for 6 weeks will clear the problem completely. I'm so grateful for your prayers. I thank you for standing with me, for believing with me, and for declaring over my life. My country, Kenya, you are the best country ever in the world. You've prayed for me and you've stood with me. I love you and I owe you. And guess what? As I've been here, since the pain has gone, the reason I've delayed for a week is because I have to do a song here in India. I must do a song of praise here in India to come and praise God with you for the miracle He has done for me. Thank you so much. I appreciate you. But hold on a minute. When I came here in India, I met so many Kenyans who had come for treatment. And as I listened to their stories, oh my God, it really agonized me. I listened to stories of Kenyans who've been misdiagnosed like me, who've gone through so much pain and suffering in some of the health facilities that we have back in our country. And it made me cry. It made me get so emotional. I was sad for days. And I asked myself, should I just come back and go on with my life just like I didn't hear nothing? Or should I do something about it? And I decided to do something. But wait a minute. I want you to listen to a pastor I met here who ministers to so many of our Kenyan patients who come here for treatment. And just for you to have a little bit of feel of what our people here are going through and why they are going through what they're going through. So just watch this, and then I will come back again to tell you what we must do.
Praise the Lord, Kenya. My name is Shalom and I am serving God in India as a pastor. This is my wife, Shilpi, and you see this little one, he's sleeping, he's called Zion. We really thank God that God has given us this opportunity to speak to all of you from India, New Delhi. We've been serving God in India among Africans, primarily our Kenyan brethren, and the very different ministry and burden that God has given us, and that is to minister our brother and sister, those who travel from Kenya to India for the medical reason. It's been about 3.5 years, 4 years that we've been doing it. We go to different hospitals, we meet different people, we meet in a form of a fellowship. Our work is, our burden is to stand with them, encourage them, pray with them, and see. And we've been seeing how God has been working into their life. We've been seeing a beautiful testimony that God has been giving them, because we believe that they come to India not for treatment, but for testimony. Having said that, there's one thing that we have been, which has been challenging us, which sometimes makes us feel sad and upset. And that is, out of 10, we have experienced in this last couple of years, out of 10, about 5 to 6 cases, which has made them to travel India due to the misdiagnosis. And this is something which really upsets us. Because if they have been treated well, if they have been diagnosed well, they wouldn't have to come to India. They come to India, leaving their family behind. They pay a lot of money to pay their medical treatment. They have small children there. They have they sell their land when they come here, and when they come to this side after when we do the treatment, when our doctors do the treatment, they find that there's nothing. Do you have something that you want to share?
Definitely, I remember there are certain cases wherein, I still remember there was a sister who came from Kenya, and there was this cotton gauze that was left inside her stomach while she has been operated. And when she came here, she was in the wheelchair. There was abscess and pus which was formed, and it took her long time to get healed. Another case that I can remember was about wherein this brother, he came, and earlier he was diagnosed with cancer, but when he came here, it was simple typhoid. So this at times makes me feel bad.
When you say goodbye to your people from an airport, you do not know what is happening to them here. We have been witnessing them day in and day out. When we stand with them, it's not easy to be in India for a medical treatment. It is not easy. It is painful. They go through a lot of stress. Not only the patient, but even the attender goes through that mental trauma. And I want to tell you, this can be avoided. This can be stopped if you do your good job there. I know that your country's been blessed with a good doctors. If you do a good diagnosis, if you do your job well, we are no one. We cannot advise you, but we can only humbly request you to do that. Because we, as a servant of God, we stand every day in the name of Jesus to stand and to pray with them. And I know that our God is faithful. He will do His work. We say the doctors treat, but God heals, and He's doing that. But when we say the doctors treat, can't we treat them well? If we can treat them well, I think we can save this nation, because we know it is not easy to be in India.
Absolutely. Just to add to what you said, I remember, everybody cannot afford coming here, and I've seen people coming without attenders.
Yes.
And going through different treatments, chemotherapy and radiotherapy, wherein it just brings you down.
Yeah.
And managing everything alone, cooking and doing all sort of stuff by yourself, it is so much challenging. I have seen people, those who have come here for the treatment for cancer at 3rd stage of cancer, 4th stage of cancer, where even when you put money, it's not going to help.
I believe it's time for us to expose these medical practitioners and doctors who are taking advantage of Kenyans. And I'm not here claiming that every doctor or every medical practitioner in Kenya is going down that road of taking advantage of Kenyans. No, I'm not saying that, but what I'm saying is that we have a whole lot of them who are out to take advantage of Kenyans, make money from them, and not really help them. They've turned the health sector into a business venture, and it's a pity to see what is going on in our health sector. I am sure that you that is watching might have had an experience in one of these health facilities, and I'd like you to go down there and comment and tell your story. If you've gone through a situation in one of the hospitals or one of the medical facilities, or you know somebody that has, let's share these stories, because these are the stories that will help us generate conversations that will drive dialogue and drive change, even in legislature. And that is the direction we need to take. We must drive conversations and dialogues that will bring change. Dear Mr. President, here is our petition that has 5 proposals that will strengthen your health agenda in your Big 4. Number 1, constitute a task force under the umbrella of the Universal Health Coverage Initiative to promote and carry out civic education to the general public on the rights of a Kenyan with regard to quality healthcare. 2, patients should have unlimited access to their medical records. 3, ensure standardization with respect to the cost of healthcare in all medical facilities. 3. The Medical Practitioners and Dentists Board to take more steps towards protecting patients from misdiagnosis, negligence, and unethical practice. Take strict steps to weed out quacks. Moreover, the general public needs to be well represented in this regulatory body. And number 5, doctors employed in the public sector should not operate private clinics, pharmacies, or laboratories. The right attitude as you serve Kenyans is very important, because I feel like, yes, we have a good number of doctors and medical practitioners who are doing a good job. They're taking care of patients and they have their heart into what they do, and we commend you for that. However, we have a whole lot of them that don't care about people anymore. Maybe it's because you're used to seeing people suffering and in pain and others dying, and maybe you're used to that. But let me put it into your thinking today that there are people who, when their loved ones die or they are suffering, they too suffer. They go through emotional trauma, and you need to be a little more human to think about others. Don't just focus on the money you get. Focus on helping lives. In my case, for instance, I went, sought for treatment, and someone quickly, without even testing me, wants me to undergo a surgery on my most precious asset. When I came here and I was diagnosed, the doctors here told me that if I was operated on, my voice would have changed permanently and my career would have ended, and eventually I would have contracted cancer. What would have happened of me? Did you think of the repercussions of you just taking my money, or what would happen to me? Is it just about the money? Ask yourself. Our president is so committed in building a healthy nation, and that's why in his Big Four agenda, health is predominantly one of the pillars, and he is so committed to making sure that that becomes a legacy in his leadership. He can't achieve it alone. We have to support him as citizens and as medical practitioners and doctors. My fellow Kenyan, I want you to think about this for a moment. Is it right for Wanjiku to go through the pains of raising money to go for medical treatment through Harambees, family and friends, doing odd jobs, getting loans, selling properties like livestock and shamba, and go to a hospital or a medical facility, and all the doctor or the medical practitioner sees is the money she is carrying and not to help her out of the problem she's suffering from? Is it right? Just because she doesn't have insurance or because she can't afford, then she's looked down upon. Is that the Kenya we want? I don't believe that's the Kenya we want. And I know that as you watch me, you probably have gone through it, or you know someone that has gone through it. And this will continue if we don't rise up now and make a change. This petition is not for me, it is for all of us. Let's come together. Let's show our solidarity to our country and to our health system by signing this petition. Be an agent of change and sign this petition. And it's easy. With only 30 seconds, let me show you what to do for you to become an agent. On your right side, there's a little arrow that points down or up. Click on it, and a link will come down here. Click on that link, and down there, you're going to sign that petition. Sign this petition, and once you sign it, share it with as many people as possible, and let's spread it like bushfire so the president can be empowered to intervene with the relevant bodies that can effect change in our country. I am tired of complaining, and I know you're tired of complaining. Let's make a change and make it now. And you know what? If not you, then who? And if not now, then when? Let's do it now. Please don't go. Don't go without signing this petition. Please, you owe our life this signature.